Good afternoon, everyone. Welcome to our first Facebook Live of the fall 2021 semester. My name is Zakia Baker, and I'm a senior here at UK studying Integrated Strategic Communication. Today, I'm joined by two experts who are here to give us more insight on the COVID-19 vaccine, provide updates on campus policies, and also dig into the science behind the virus. Dr. Becky Dutch is a virologist and the Vice Dean for Research at the College of Medicine. I also have Dr. Alice Thornton here, who's the Chief of the Division of Infectious Disease for UK HealthCare. Thank you so much for both joining me today. I'm really excited to have you here and learn from both of you.
Thank you.
Thank you. And we're going to jump straight into the questions.
Great.
So the first question I have is, can each of you give us more insight on what you do here at UK?
So, okay, I'll go ahead and start. So I do a variety of things. First, I'm a research scientist, and for 30 years I've been studying viruses, and most of my work has been on RNA viruses that infect the respiratory tract. And I still run a research lab. So that's part of what I do, and I'm very involved around the nation and around the world in the virology community as it studies different things, and particularly now with SARS-CoV-2. Second, I've been frankly very fortunate to get to be very involved with the COVID response here on campus. So I do a variety of things. I work with the START team, which helps provide advice to the provost and president about policy decisions. I've been able to work with something called the Cure Alliance, which has been really looking at how do we stimulate research, clinical and basic research on the virus here on campus, how do we spread information better, those kinds of things. And then in my other part of my job as Vice Dean for Research, I get to oversee research for the college. And I guess the last thing I get to do is teach. So I actually teach virology. It's Bio MI 582 in the fall, so I teach half of that class, and it's going on right now.
Nice.
Thanks for having us here. So I'm the Chief of Infectious Diseases, and I came to UK about 23 years ago, and I have always been and very heavily involved in HIV care. And so we have about 1,600, 1,650 HIV patients that are seen on campus here at UK at the Bluegrass Care Clinic. And so I've devoted most of my life, like Becky, into viral illnesses. And so I see a lot of correlations between COVID-19 and HIV, and it reminds me a lot of my earlier training days, just a lot of the things that we've had to combat with. So this last fall, or not fall, but in the beginning of 2020, we spent a lot of time coming up with protocols. We went from the very beginning, how do we even test for COVID, to now we're talking lots more about treatment, and then of course vaccinations. So very involved in that space, involved with a little bit, I've taken care of patients in the hospital, but I've done a lot more outpatient taking care of people with COVID. So that's been my involvement.
Yeah, thank you both for sharing your experiences. It's amazing to hear about it and learn about it. And I'm sure a lot of our students and community don't know what you all do behind the scenes, so I really appreciate you all. Moving into the next question, it's going to be for you, Dr. Thornton. So can you describe to us what you're seeing in the hospital right now and what that means for the importance of vaccination?
Yeah, thank you for asking that question. So back in I think it was about the middle of June. It looked like there might be, from looking at records from or news from other parts of the country and the world, there was concern about the Delta virus. And then by July, it was personally affecting my life as a physician. And so about the middle of July, I saw our first COVID patient again with this surge via telemedicine. And then the very next week, it's been a new patient each week coming into our office, not even knowing they had COVID, coming in, seeing us for their HIV or other issues that they might be coming to us for, and finding out they have COVID. So we definitely have seen a huge uptick, just like everybody's seen in these numbers. Our hospital, we have anywhere from 80 to 90 patients that are actively infected with COVID. About half of those patients are in the medical ICU. So we really are maxed out as far as the number of, we're not completely maxed out, but we're really straining the hospital with these COVID patients. I get to be part of a weekly call with providers in the Lexington community, and I'm hearing the same thing all over Lexington, that we're having lots of patients coming in. And the one point that's so relevant to this discussion today is that we've had, I'm just looking at my notes, about 82 patients yesterday that are in the hospital. About 4 to 6 of those were children. So children don't really have a choice for the most part. Most of them are unvaccinated. But of those patients, only 85% of those patients were unvaccinated. So that's what we're seeing, is we're seeing people being hospitalized. This time around, people being hospitalized without vaccinations. Before, none of the folks were vaccinated, right? And so it's really scary.
Yeah.
As an infectious disease doctor, I'm telling you it's really scary to see so many people hospitalized with COVID, and the large percentage of those are unvaccinated.
Yeah.
And I think one of the things I'd add, because I get to talk a lot to the people who work in the ICU units, and it seems that one of the things, and it'd be interesting to see if you're seeing that same experience, there's a difference in the unvaccinated and vaccinated populations that hit the hospitals.
Yeah.
Those who are vaccinated in the hospitals generally have they have underlying conditions, people with transplants, people who are immunosuppressed, things that make it much harder for your immune system to respond, or potentially lots of comorbidities that you knew put you at a much higher risk. And the average age of those people is much higher. But we're seeing a lot of people who were healthy in their 20s, 30s, 40s hitting the hospitals now who are unvaccinated.
That is a great point, Becky. And just to emphasize that a little bit, I mentioned about half of those patients are on ventilators, or maybe not half on ventilators, but half of them are in the intensive care unit, and then another percentage of those people are on ventilators, probably a third. And of the patients that are on ventilators having to have assistance to breathe, only 6% of those are vaccinated. The large percentage, so that would be 94% of the people that end up on a ventilator in our hospital right now are unvaccinated. So that was a preventable, right?
Yeah.
So it's heartbreaking as a physician, as an infectious disease doctor, to see someone admitted potentially and most likely could have completely been avoided.
Yeah, it's very unfortunate to hear that. And I personally have seen things in the news and heard about it, but I never knew the actual stats and how bad it is right now. So,
Yeah.
And
thank
that's
you
right
for
here in
that.
Lexington, and that's
Right.
the thing
Yeah.
really for people to remember.
Yeah, I agree.
And that's what we're hearing, in that call I was telling you about. I'm hearing that St. Joe, Central Baptist, the London Hospital, we have friends in Paducah hearing the same kind of thing.
Okay, gotcha. Moving into the next question is going to be for you, Dr. Dutch. We know the Pfizer vaccine was recently granted full FDA approval. Can you explain what that means and a bit about the process of creating the mRNA vaccine?
Sure. So full approval means that the FDA has enough safety data over a long enough period of time that they can confidently say this vaccine meets all of their safety standards equivalent to any vaccine they have approved in the past. So that's where full approval comes in. Prior to this, we were on what's called emergency use authorization. That came about because it met all the safety standards they could see, but they needed more time and they needed more patience to track and make sure they weren't seeing anything that only came up rarely, and they don't. So now we're at a point when that vaccine is deemed to be as safe as any other one we get. We get polio vaccine, we get all sorts of other vaccines. This one is just as safe. So that's what that means. And I know there have been people who have wanted to wait for vaccination saying, oh, it's not been fully approved. It is now fully approved.
Yeah.
So the mRNA vaccine, in my mind, is a real sign of just how much we've learned from science. And frankly, it's somewhat miraculous that we could create vaccines this quickly. But it didn't just come about out of nothing. It's been more than a decade that they've been working on that kind of vaccine, these mRNA vaccines. The strategies were developed quite a long time ago. They did some of the initial work on a series of different viruses, including the original SARS. They were looking at whether they could make mRNA vaccine to that. So sometimes people will say, it's too new. Well, the technology is not new. The only thing that changed is which messenger RNA they put in the vaccine. That's all. So what is an mRNA vaccine? It's pretty simple. Messenger RNA, think of it as like the little sentence that tells your cell how to make something. In this case, it's something called a protein. It's the building blocks of life are these proteins that we use. Our cells make thousands of messenger RNAs that make thousands of proteins. So do viruses. So what we do is we put a little messenger RNA that encodes one viral protein called the spike protein. That's the one that sticks out on the surface. We want our antibodies to see it. and you put it in something that's going to be able to be taken up into cells. It's like this lipid particle. Lipids make up our cell membranes normally anyway. And when you inject it and it gets into a cell, the cell for a very short period of time, for a day or two, makes that one viral protein, the spike protein, and your body says, oh, that's foreign, and it reacts to it, and it makes your immune system come on. It turns on antibodies, starts to make the memory B cells you want for a later response. You get a T cell response. That's what the vaccine does. You get two because that second one gives you what's called a boost. Our immune system sees something the first time and starts to get prepared. When it sees it a second time, it boosts it to be fully prepared. And that's why it's a two-shot protocol. And it's, if we had not had all those years of preparation, this would not have worked this fast. But because we did, they just had to switch what that messenger RNA was, and they were ready to go.
Becky, I was talking with one of my patients. It's almost like if you were in a factory making a car.
Yeah.
You had that template to make a car.
Yeah.
But now that you have this new virus, you take that template and substitute it. So like if I was making a Chevy 10 years ago and I wanted to make a Cadillac, I could kind of take that template and make a different car.
And
right?
actually, I think we're going to see mRNA vaccines used in lots of other systems coming forward. But the reason we were so fast with this is as soon as they got the sequence of the spike protein, which came out in January, they were able to start engineering this up. They were putting this into patients by March of 2020.
Yeah.
So we have people who first got their shots a full year and a half ago. So we've watched the safety data, we've watched all these other things. We've never had issues with long-term. And that's another important part with vaccines. If you're gonna have issues, they happen in those first few weeks after vaccination. We have no history in any vaccine we've tried and any of the mRNA vaccine work that's been done over a decade of anybody showing up with a problem later. And it's also important to find out that same messenger RNA, if you get infected with COVID, you're going to have tons of it in your body because that's what the virus is going to do. It's going to get in your cells. It's going to make lots of these different proteins, including the spike protein. So you're going to get that messenger RNA either via vaccine or being infected. And honestly, the way COVID is working, you're going to get it one way or the other. The vast majority of this world's population is either going to get vaccinated or infected. And either way, you're going to get the messenger RNA. The vaccine is a safe, controlled way to get your body to react so it's protected.
Yes. I do remember, if I'm remembering correctly, in the past few weeks, I've seen that a recommended third booster shot is out. Can you explain what that is?
So that's it's an interesting question. So all a booster does is reintroduce the thing that the body should recognize to basically to wake you back up again to further have an immune response. So there is a recommendation that people in a very small set of groups right now get that booster. Those would be people who've had transplants, people who are immunosuppressed, because we know those are the people that are highest risk even if they've been vaccinated. There's still a discussion of whether we should have a third booster for everyone, and that discussion is still ongoing, and it's a very complicated question. A third boost does raise your what's called your circulating antibodies. Those are things that help you the minute you start to get infected. But it's the rest of your body system that protects you. And what we're seeing is in vaccinated individuals, if I caught it today, you'll get an infection that starts and you'll see virus and then very rapidly your body will beat it. With the exception of people who have serious underlying conditions, and that's why we see them in the hospital. So the question is, do we need that third boost for everyone? They're still trying to look at that. And there's also a world issue. We have a lot of the world who has not gotten vaccinated. There are portions of the world, countries that have under 5% of their population vaccinated. Honestly, so I think Alice listens to Daniel Griffin too. He's a fan. I have friends who do the show called TWIV, and Daniel Griffin's an infectious disease doc who's fantastic, and I love his phrase, none of us are safe until everyone is safe. And I think that's an issue we need to think about with the boosters.
That's a great.
Gotcha. So going into the next question for you, Dr. Thornton, something we hear frequently is the idea that COVID has a very high survival rate. I think the thought may be that safety measures such as the vaccine and mask aren't as necessary because even if they do become infected, they are less likely to be severely sick if they're vaccinated. As a medical provider, what is your response to that perspective?
Yeah, that's a great question and one we hear a lot. And there's a lot that's sort of packed into that. So if you think about COVID, who gets COVID? What does it look like? So with COVID, there's like a pre-symptomatic phase, and then there's a symptomatic phase, and then, post-symptomatic phase. And so most of the people that get COVID, they're not going to go to the hospital. It's true. Probably about 85% of people that get COVID will not go to the hospital. Will not need to even go to the hospital. Then that means there's about 15% or 20% of people that will end up in the hospital. We know from looking at China and other places that had their big spike earlier than us, but looking at some of that data, we know the older a person is, the worse they're going to fare if they get COVID, right? And so particularly before we had the vaccine. So we knew that someone that was 80 had a less chance of survival compared to someone that was 20, okay? Mm-hmm. So then we think about, well, what else do you take into it? So we've talked about age. Then we talk about health status that Becky has brought up a little bit. So people that are diabetics may have a harder time. People that have underlying pulmonary disease, so that could be COPD, but it could also be severe asthma. And so you start breaking down someone's chance of survival is really, it's not just based on their age, but a lot of different factors. And so then we look at that. Then if you think about so then we just need to worry about the old people. That has not been my clinical practice. I think about a patient that I had, and it just broke my heart. She was in her 20s. She was at home with COVID. She continued to become ill. She was a little overweight, but definitely not morbidly obese. She died on the ventilator with COVID. I can't explain what made her die. And so when I hear that someone has COVID, no matter how old they are, I take it very seriously, because I don't have the ability to predict who's going to do horrible. I know if you're older and you have immune issues, you are probably going to do worse. But then there's this weird case that the person will be younger and go on to die. So it's far better to look at that, prevent from even getting into the hospital. And that's where the vaccines come into play. They prevent hospitalizations about 85% of the time. And so that is so much better, and your chances of survival are going to be so much better if you're vaccinated. Mm-hmm. As we just said, 85% of our patients that are admitted at UK right now with COVID are unvaccinated. So that's becoming a common theme. You're hearing that number. And so it's so important to increase your survival by being vaccinated.
Yeah. Thank you. And that actually kind of connects to the next question for Dr. Dutch, which is, if someone has previously contracted COVID-19, what level of immunity does that provide afterward, and how does it compare to the level of protection offered by the vaccine?
So this is a great question, and it's one that gets debated around the nation. There are people who want to say, oh, natural infection is as good or better. Mm-hmm. It's not, and it's complicated. Why is it complicated? Well, what we see with people with natural infection is the level of their immunity is really variable. There are people who get COVID and have almost no sustained immune response to it afterwards. We don't know why. We have other people who get it, and a year and a half later, they still have a nice sustained immune response. There's various ways you can measure that immune response. What it says is natural infection has, just as Dr. Thornton talked about the wide variety of how ill people get, we had a wide variety in how well you respond to the virus in a natural infection. In contrast, when you're vaccinated with, for instance, we'll talk about the mRNA vaccines, after that second dose, they have a very similar level of immune response among different people after they finish the vaccinations. Now, some people who have issues with immunosuppression may lose it faster, but most people keep it for a nice long time, and it's nice and high. So what that means is, even if you've had COVID, unless you know exactly, you're testing yourself all the time and you're not sure how immune you are. And we also know that if you take someone who's had it, it's like that first shot. Mm-hmm. You give them a shot, they get a really nice boost. They boost right up to the same level of antibodies and other things that we see in people who've had 2 doses. Yeah. Mm-hmm. So it's really important, even if you've had it, to go ahead and get vaccinated, as I said, unless you actually want to test yourself all the time and see mm-hmm. how immune you are, because you don't know. You mm-hmm. could be one of those people who has very little residual immune response even though you had COVID, and that means you're at high risk.
Mm-hmm. And can you touch on how long that natural immunity lasts for people who are unvaccinated?
So it's a complicated question because the answer is, again, it probably widely varies. I really do know someone who had it a year and a half ago who still has really high level antibodies responses to it, and has a family member who had it at the same time, and they have the same. So genetically, there may be some reason that group has it more. In general, people wane their immune responses from natural infection over the first 6 months. They really see a decrease. And we see a change in our antibody levels, even from the vaccine, slowly over time. But we know with vaccinated individuals, they have these things called memory B cells. They're like the things sitting there ready to pounce when they get reinfected. Those are active and ready to go, as are the T cells. So you have, most people who have been infected will have some level of immunity. Some will have great and it'll last a long time. Some will have great and it'll wane. Others will have almost none. Vaccinated people will be having a constant higher level that lasts longer. And that's where the complication comes. It's not a simple question where I could give you an exact time, but I can tell you most people who have it, they don't have any idea how protected they are if they've just had COVID.
And to add to that, some of the patients that I follow telemedicine that have gotten COVID, they wonder, well, okay, when can I get the vaccine? And really, you can get if you've had COVID, you can get the vaccine as soon as you get out of isolation, if you would like.
Right.
You know, sometimes people don't feel well and they don't want to get it immediately, but I encourage people to go ahead and get it as soon as they feel able to get out there, because it's just like Dr. Dutch said, they're going to actually get the best response from the vaccine because they've sort of already zipped.
They are primed and ready to go. Yeah.
Gotcha. And so we're moving to the next question, which I guess one of you touched on it a little bit earlier, but a common fear seems to be that the vaccine may have unexpected health consequences or impact on fertility. What would your advice be to individuals who hold that concern?
Yeah, and so I think that's a fair question for people to ask that are looking at fertility. We definitely, want to protect the unborn. And so when the vaccines first came out, I think there were more questions about that. But now that we're a year and a half, almost 2 years into this, we actually have some very nice data. One of the first things I will hit first is sperm. So some people think, oh my goodness, my sperm is going to be less. There was a small study done, I think it was out of Miami, where they looked at the sperm of men before vaccination and afterwards. And actually, there was no difference in the amount of active sperm that someone had before or after vaccination. So that sort of just popped that, answered that question right away. There's been, particularly this summer and this spring, there's been some very nice papers that have come out about women who are either pregnant, breastfeeding, or anticipating pregnancy. And in those studies, there is no difference in the amount of bad outcomes as far as miscarriages or outcomes of the baby in those that have been vaccinated when you compare vaccinated versus unvaccinated numbers, what the usual numbers are. So there's no signals to say that it's unsafe in pregnancy, which is really exciting, or in breastfeeding. Actually, and I put a plug in here, for the breastfeeding individual, and actually for the person that is pregnant, you may actually be able to give your baby some of those antibodies. So what a nice gift when that baby's born, or while that baby's being breastfed, when they're too young to get the vaccination, they're actually going to get some of mama's antibodies, which is a great thing.
Yeah.
And probably one other thing I'd point out is, particularly with the Delta variant, having COVID when you're pregnant is dangerous.
Yes.
And we have had
Excellent
a lot
point.
of pregnant women in the ICU.
Yes.
You do not want that. So it's another reason to make sure if you're pregnant, get this vaccine.
And I believe all the organizations that care for pregnant women have come out unequivocally this summer and said all pregnant women should get vaccinated. And so again, about those studies that did not show signals to indicate that there was danger, and the benefits far outweigh the risk.
Yeah. Okay, thank you so much for that. Switching the focus to more of our UK campus community, Dr. Dutch. We know that in-person experience is crucial to our students' success and well-being of all members of our community. So how can we balance this with prioritizing health and safety at UK?
So this is a really important point. As we deal with a pandemic, we also deal with life. And for many students, isolation has made things incredibly stressful. Prior to the pandemic, we already had rates of anxiety and depression that were around 40% in college populations. They have skyrocketed. I remain very concerned about rates of anxiety, depression, suicide, and also just letting people start to launch their lives. Mm-hmm. So I've been a huge advocate, as have many people here, for getting people back on campus, because we have to balance the risk. If we do the things we're supposed to do, we get vaccinated, we wear masks at times when there's high community transmission, like right now in Lexington, we can navigate this safely. And at the same time, therefore, we can get students back in the classroom where they can interact, where students with backgrounds where they may not have resources at home can get them here, where students who, frankly, this environment's going to help them deal with anxiety, depression, can get back engaged in life. And so I think that's the thing. We have to really start thinking, how do we take care of each other? Mm-hmm. And how do we address all of the issues we have, not just COVID, but these other issues like, increasing suicide rates and the need to address depression and anxiety in our young people. And so we've got to find that balance. And so if we can do the right things for COVID, meaning take our preventative methods, mm-hmm. then we can also do the things that put us safely back in the classroom. I teach in person here. I'm in a mask right now because we have high community transmission, but the students seem to be thrilled being back to class. Yeah. And I think we want to do everything we can to keep both things, keep us as safe as we can and keep us here.
Mm-hmm. I think that's a great point. It's all about learning how to live with this problem. It's not immediately going away. Mm-hmm. And so I think taking the tools that we have, and our tools have changed, right? Yeah. When we first became aware of this new virus, we only knew to use masks. Mm-hmm. And now we have more tools. We have vaccines, we have monoclonal antibodies, we have treatments that work in the hospital. And so I think it's all about living in this environment currently and using the best tools that we have at that time.
Yeah.
Yeah. I agree to both of you all's points. I'm a student, but also outside of that, I'm a resident advisor. So last year I saw a lot of that mental health issues with my residents. So I agree that being back on campus is kind of boosting their morale and their mental health. Yeah. And also they're having kind of concerns about what if we go back on a lockdown. But I like to hear that we're trying our best to keep students here and just help them overall adapt to it. So thank you for that. The last question is for both of you. So what general advice do you have for the UK community?
So if we want to have our students back, which we very much want to, we want to have young people launching their careers, we do have a tool. It's vaccination. Mm-hmm. And then we can go back to those old tried tools, which are our masks, when we need to wear a mask when we have high transmission, or if you're unvaccinated, even if you are vaccinated with high transmission. Think about those closed spaces that don't have good ventilation. If you find yourself in that, wear a mask. Crowded places indoors, wear a mask, and close contact face to face. And so I like that we're demonstrating today, we're close, we're close to each other and we're wearing our masks. So think about that, use the tools that you have, because we can't just stay locked up in our rooms. We have to emerge, but we can emerge safely and use the tools that we have, which include vaccinations.
Yep.
Yeah. Well, I want to say again, thank you so much for joining me today and giving all of this information. Also, thank you to the viewers who are tuned in today. If you have any questions, go to UK's coronavirus website. Have a great day, and thank you, Wildcats.